Hey guys, it's Pat. Today I'm going to show you how to develop a digital PCR using the program EMSCharts.com. We're going to begin by logging in, username and password in the upper left hand corner. I'm going to make sure that you're in the right agency, Camden County College, the right unit. You're going to move over to patient records. Since you're in patient records, I'm going to click create new chart. Okay, and in the top where it has the run number, you can put in today's date and H if you're hybrid, or T if you're traditional, or whichever group number you are. I'm going to zoom in here so you can see what I'm talking about. There's today's date, H1 for hybrid 1. And I'm going to scroll down, go over to category. This particular chart is going to be for a diabetic patient. So I'm going to scroll down to diabetic problems. And then dispatched as, it's also going to be diabetic problems. Sometimes we get dispatched for things other than what the patient's actually complaining of. Outcome, who actually treated this patient. This patient is going to be treated by BLS and ALS and transported. Okay, crew members, D is for driver, that's who drove the ambulance. For this particular chart, I'm going to say that Miss Debbie drove the ambulance. She's going to be listed as the driver. There she is, Debbie McClintock. And P for primary caregiver. Since I'm your instructor, we'll put that as me, Patrick McElhenney. And moving on over, other type. Where did we pick this patient up? We picked him up at his residence. And the location, we're going to click the magnifying glass and type in the address of where we picked the patient up. 123 any street. City, it's going to be Blackwood, New Jersey, 08012. And I want to select the county. Scroll down to Camden County, select save. Alright, the requester, who asked for the ambulance to show up? It's the person who called 911. Alright, mood, we drove there with the lights and siren on. Okay, scrolling down. Receiving, it's the name of the hospital that we transported the patient to. So we click the magnifying glass. I'm going to search for it by state. That's the easiest way. So we're going to scroll down to New Jersey and click search. And it gives you a list of all the hospitals in New Jersey. I'm going to go down. I want to say we transported this patient to Virtua Marlton. Automatically populates it. And why did we go to that particular hospital? Because it was the patient's choice. Remember, we drove there with the lights and siren on. Alright, we're going to zoom out so you can see the entire field. And we're going to move down to add patient. Okay, I want to search for an existing patient. You should always search and see if your patient's in the system. Start with the last name. Our patient's last name was Smith. His first name, John. Okay, click search. All right, a few John Smiths are in the system. None of those are our patient though, so we're going to add a new patient. All right, you're going to continue filling out your patient's demographics. Add his middle initial, social security number. And down to the patient's address. Zoom in here so you can see. You can either type in the patient's address. If you picked up your patient at a public place and he wasn't at home, you would type it in. But we picked up our patient at home, so we can actually delete this. Alright, we can click that blue arrow there to the left, and it'll give us the address that we typed in earlier. So we can use that and automatically populates it. It'll save a little bit of time. Alright, our patient's phone number. So 856 555 1234. Alright, birth date. Makes Mr. Smith 30 years old. Move over. His gender. He's a male. His weight. A typo there. All right, I want to change it from kilograms to pounds, unless you know the conversion. All right, we're actually going to make him 150 pounds, a little more realistic. Okay, his race is Caucasian, and we'll click Save. All right, so now our patient has been entered into the system. You can review everything you did at the top there, and we can move down to our patient's medical history, the information you obtained during your sample history, and you can start typing it in. So he has high blood pressure, HTN, right? He has diabetes, so you can type it in, click Add. All right, and we're also going to say that he has asthma. So start typing it in, we'll see that it automatically populates it, and click Add, and done. And moving down to the patient's medications. All right, so what does he take? Takes insulin for his diabetes. Okay, click Add. Say that he takes an albuterol inhaler for his asthma. Add. All right, and he has that high blood pressure. We'll say that he takes low pressor to control his high blood pressure. Click Add and done. All right, moving down to allergies. What allergies does Mr. Smith have? We'll say that he's allergic to shellfish, and he's also allergic to penicillin. I'm going to use the abbreviation there, PCN. All right, how did we get this information? We got it from his family because he wasn't able to respond to us appropriately. And we're going to move on to the next page. Okay, his system, what system is being affected? Diabetic problem, and it's the endocrine system. All right, his symptoms, the low blood sugar, he would have a change in responsiveness. Scroll down, diabetic symptoms, click, save. All right, zooming in there, chief complaint. His chief complaint would be change in responsiveness. We can't say a hypoglycemic or low blood sugar because that would actually be a diagnosis. And as EMTs, we don't diagnose. So how long has he had this change in responsiveness? We're going to say for 30 minutes. And then the history of present illness. Now, in your history of present illness, this is your opportunity to paint the picture of everything that you know about what happened to your patient before you got there. It's the history. It's everything that the bystanders describe or the patient may be able to describe to you. Everything that led up to your patient having his or her current problem. So we'll say that the patient's family stated that the family sat down to have breakfast together, and the patient excused himself to take his insulin injection in the restroom. When the patient returned, he stated he didn't want to eat breakfast. He wasn't going to have anything to eat. Okay, so then he just sat down on the couch. When the meal was over, approximately 30 minutes later, the family finished their meal and noticed that he was unresponsive. All right, so they called 911. I want to use as much description as you possibly can in this section. All right, you don't need to talk about any interventions that you did or any kind of assessment findings that you found. You want to talk about everything that other people told you, but be as descriptive as possible because this chart is ultimately going to be read by people who were not there and they want to know what was going on with that patient. All right, so the scene description, what type of a scene was it? I want to describe it in 1 or 2 sentences. So it was a single family dwelling with multiple bystanders, and the police were on location. All right, patient belongings. Often we transport our patients and they have personal effects with them, whether it's a wallet, a cell phone, something along those lines. Most agencies use this patient belongings field. It's really in your benefit to be descriptive in here, describe exactly what the belongings were, and put in a little note indicating that those belongings were left with the patient at the emergency department. Okay, his level of consciousness. All right, loss of consciousness is yes. All right, I'm going to change the pupils from normal to dilated. And reactive, they were a little sluggish to respond. Eye opening, none. He didn't open his eyes at all. Didn't have any verbal response. He was not speaking. Right, and no motor function. Right, his airway was patent, and it's already filled out. Click next. And change the pulses. We only check the radial pulses on this patient. Okay, and he did have a delayed cap refill. Alright, you want to type in the physical findings that you find on this patient. For this particular patient, we had poor skin conditions, so pale and sweaty. We didn't have any injuries, so we wouldn't have to put in anything else. Alright, and this is the activity log. If you remember from your book, the book spoke of documenting a narrative, like a written story as to exactly what happened with your particular patient. For this program, instead of having a long drawn out narrative, we have an activity log which is written in timeline fashion. Alright, so our first timestamp is going to be at 12:05, okay, and we are going to indicate that we arrived with the patient, and we wanted to describe the initial assessment that we performed on this patient. So the patient was not responding to any stimuli, his airway was open, breathing was shallow, and circulation was present via radial pulses. Alright, continue to go on. We're going to describe his poor skin condition, which is an indication of poor perfusion. So the patient had pale, moist skin and delayed cap refill. Okay, and our patient was unconscious and unresponsive, so we obtained all this information from the family. We want to indicate that in here, so with a brief line about why the ambulance was summoned to their house in the first place. So the family stated the patient took his insulin and did not eat. Okay, we have the protocol box. If there was a specific protocol that allowed you to do a specific procedure, that's where you document it. There is no protocol for just the basic patient assessment, so you can continue on. Alright, that was the first timestamp. 1 minute later, 12:06, when as a team we did our full assessment and got our first set of vital signs. Okay, so his heart rate is 90, his blood pressure is 90/60. Okay, his pulse ox is 92, his respirations are 12. If you remember from earlier, we said they were shallow. Alright, moving down to comments. Just want to describe what it is that we did for the patient. So, the patient assessment began. The vital signs were obtained, as noted by BLS. Alright, and his level of responsiveness. Okay, he didn't have any pain. And we're going to go down to save and add line. Alright, moving up, the next timestamp. All right, remember we said our patient had poor perfusion, so he needs to be on some oxygen. So all you have to do is put in the time and go down to add action, and it's an airway procedure. All right, the crew ID is Debbie. She's the one that gave the patient the oxygen. All right, I'll click oxygen. The liter flow, it's 15 liters per minute via NRB, which stands for non-rebreather. All right, and his status improved after the oxygen was administered. Okay, moving on. All right, the next timestamp, it'll be a couple minutes later. We'll zoom in so you can see, 12:10. All right, we continued on with our patient assessment after we gave our patient some oxygen. So, the history of present illness, a sample history, and an OPQRST were obtained. And remember, our patient is unresponsive, so we're going to indicate that we got this information from the family. Okay, add that to the timeline. All right, a few minutes later, 5 minutes later, after we got all of our information, the paramedics finally arrive. All right, and we give them a verbal report. So they were briefed of the patient's condition, and we indicate that both the paramedics and the BLS continued patient care. All right, next timeline. Zoom in so we can see. Alright, so at this point the paramedics would have performed some paramedic level interventions that's going to make this patient a whole lot better and bring his blood sugar up. It would be inappropriate for an EMT to document exactly what those interventions were because it's out of our scope of practice. But we can document that our patient's mental status began to improve. If anybody reading this chart would want to know exactly what it was that made that mental status improve, they would have to refer to the chart that the paramedics developed instead of ours. Okay, 12:25. After the paramedics did their intervention, they're going to want to reassess the patient, which means an additional set of vital signs. So they have their heart rate at 88, which is a little bit better than before, as it was a little tacky before. His blood pressure came up a little bit, which is awesome. All right, his pulse ox is now 99%, much, much better than it was. His respirations are now 16 and regular, and he's alert. So our patient's condition is much better than it was earlier. All right, I want to put a little note in there about our patient's vital sign assessment and that his condition is beginning to improve. All right, so vital signs were repeated. The paramedics took these vital signs, so we want to make sure we document that. The patient was loaded into the ambulance, secured to the stretcher, and prepared for transport. I just want to make a little note about his mental status continuing to improve. All right, still doesn't have any pain. All right, next timestamp down. All right, nothing really happens to your patient during transport if no interventions are performed and your patient's condition doesn't change. All you really do is monitor the patient. Your next timestamp can be the time that you arrived at the emergency department. All right. 10 minutes after we arrive at the emergency department, we transfer care to the emergency department nurse. All right, we transfer that care by giving a verbal report and oral report, directly speaking to the nurse, explaining what the patient's problem is, the interventions that we performed, the result of those interventions, and the patient's current status. All right, I want to say that we transferred him into ED bed number 5 without incident, indicating that we did not drop him or he didn't trip or anything along those lines. And the patient's mental status and condition remained unchanged. So unchanged from previously when we mentioned that his mental status was improved and that he was alert and oriented. Right, 2C stands for transfer of care. You're done. That's the extent of the narrative. All right, now we need to electronically sign the chart. Signing the chart indicates that everything in it is accurate to the best of your knowledge. All right, and finally, if you want to review the chart, you want to see it in the way that an outside person would see it, you can click on Patient Records. All right, there's the chart. And this is the way it would look if it was to be printed out and given to a doctor or a lawyer or your chief. You can see the different parts of it. Scene description, chief complaint, HPI, history, meds, allergies, neuro exam, physical exam, and your activity log or your narrative.